So we think that this issue of resistance in hospitals is very severe. We're seeing now organisms that are resistant to every antibiotic we have, that can spread rapidly from patient to patient and organism to organism, that kill up to half of the patients they infect, what are called CRE, or carbapenem-resistant Enterobacteriaceae. That C stands for the most extended spectrum, strongest antibiotics we have. These organisms are now resistant in some cases to everything. But we actually have some hope, for this reason exactly, that the things that are straightforward and simple can actually work to turn this around. And if we can see slide 20, we're now recommending that every single hospital in this country have an antibiotic stewardship program with commitment, single leader, usually a physician, systematic tracking, education of doctors, reporting back consistently, and implementation of policies such as an antibiotic timeout. So yes, if you got a patient who's sick, start it right away after you get the test to see if the patient really has an infection, and then 24, 48, 72 hours later, stop, think. We did an analysis. In US hospitals, half of all patients get an antibiotic during their stay. Of those antibiotics, about a third are either unnecessary or inappropriate. So when we're piling on antibiotics for too long, too widespread, unnecessary, too broad spectrum, we're really breeding more and more resistant organisms. But we do think we can turn this around. And the next slide, 21, shows what we propose to do if we get additional resources in the 2015 budget. We think we can cut both C. diff, which contributes to the death of 14,000 people a year in this country, and CRE by 50% in 5 years. We're confident in that. Dr. Denise Cardo is here with us, and her unit is in charge of this. And they're terrific, fantastic staff throughout CDC. We work in collaboration with hospitals. Every single hospital in the country virtually is now reporting in through the National Healthcare Safety Network. They're essentially incentivized to do that through CMS, and that information is increasingly transparent. We worked with hospitals. The American Hospital Association is on board with this. We've worked with community groups and non-governmental organizations. The Consumers Union, Consumer Reports, have been terrific advocates for this. We now have 30 states that have mandated public reporting of this, and it's going to be on the CMS website from the CDC data. So we think that with investment, we can see that kind of impact as we have in immunization.